Thank you very much, Jerry. Thank you very much, all 6 of you. Fantastic stuff there, and I'm sure there's masses and masses of things people want to ask questions on. Should we give it a go at having 2 questions at a time, and then we've got 2 topics, and if we keep the questions short, then we'll get more questions done. 2 people there, Fergus and Harry, isn't it?
Just a question for Jeannie, really. Given when the FCTC negotiations were going on, a question for Jeannie. When the FCTC negotiations were going on back in 2000, what do you think they thought they meant about harm reduction back then?
Fergus Mason, leader of Vapers and Power. Ms Arnott, you mentioned that you're concerned that the growth in vaping has slowed down, and you talked about how there's misconceptions about the harm or addictiveness of vapour products. But you lobbied for the TPD, which forces manufacturers to put inaccurate and scaremongering health warnings on the products. I believe that the misconceptions about the harms and addictiveness are because of people like you who demand laws that we don't need on products that you don't understand to avert dangers that don't exist. So my question is, why can't you just leave us alone?
Okay, the question about what did the negotiators mean by harm reduction when they put that into the FCTC. I think to answer that, I'll just say a really important thing about treaty interpretation for multilateral treaties. In terms of interpretation, there's 3 ways, and there is the text, what is written, teleological approach, which is what was the object and purpose of the treaty, and thirdly, the intention of the parties who negotiated it. Now, we tend to look, and legal interpretation tends to look often only at what is written, but if you look at the Vienna Declaration, the Vienna Declaration on the Interpretation of Treaties, Articles 30 to 33, it tells how treaties should be interpreted. An object and purpose, i.e. to reduce harm, or to reduce all those human rights things that I put up, and the things Jerry would be arguing, should be equally used as well as what's in the text. As to the intentions of the parties who use those words, what happens in that case is that they look to what's called the travaux preparatoires, what was actually said, and that can be gone back on. However, having been there and having seen the negotiations themselves, even though it was that long ago, I do recall, and this is the other thing when it comes to treaty negotiations, not necessarily interpretations, they are negotiated in 6 official languages. So you therefore have, in a sense, people putting forward, countries putting forward in one of those languages. So the fact that it actually got into the treaty as those words, I believe that some of the more progressive thinking countries, and snus was definitely included at that time as seen to be a reduced harm product, is that that was what they actually intended, what we have now. But what has happened is that the interpretation has been politically motivated to include more about the quitting and cessation. I can talk more about it, and I have a document if it can be helpful.
But also, Jeannie, what I add is that because the treaty is about regulating the product and not banning it, by definition it's about harm reduction, and harm reduction isn't just about product and how you treat the product. It's actually, legislation to prohibit smoking in enclosed places, for example, is about harm reduction. There are lots of measures there. So it runs throughout the treaty, it's not just about the product.
Yeah, I agree.
Okay.
To answer the second question first, well, I still believe passionately that the TPD is an important and progressive measure, because we have, in the UK, nearly 100,000 people dying from smoking-related disease every year. It's the leading cause of premature death. Responsible for half the difference in life expectancy between the richest and poorest in society. And amongst people, certain disadvantaged groups in society, smoking rates are much, much higher. The average for people with a diagnosed mental health condition is 40%. For people with schizophrenia, it can be as high as 70%. So I will not apologise for supporting the TPD. What I would say is that the measures on e-cigarettes were negotiated at the last minute, right at the end of the treaty. We certainly didn't support the health warning on e-cigarettes. So, you know, I won't take responsibility for that, but I still support having the TPD. And there are lots of measures in that that are really important. And the reason why smoking prevalence is going down in the UK the way it is not just due to e-cigarettes. They play a role, but it's due to a comprehensive strategy to tackle what is a disastrous public health epidemic, and which is killing 6 million people around the world. 80% of them are now in low and middle income countries. So I have no apology for tackling smoking. One other thing I would like to say is that it's nice to give credit to Gerry. Gerry's done lots of good things, but actually vapers have been much. Gerry came late to the party. It was the vapers who were really important in the UK in helping develop the debate, much more than Gerry. I'm sure you'd agree with me.
I saw Cecilia there. I think one at a time might be easier. We'll remember the topic.
Hi, I'm Cecilia from Swedish Match. I went to a conference in Brussels some years back with other girls from the smokeless industry, promoting low nitrosamine tobacco, smokeless tobacco. And in the room was a man from WHO, and when he understood that we were in the room, he stood up, of course, and left a big drama thing. And I'm just thinking, I guess, Jeannie, that WHO really should be the guardians of that treaty in the same way that the European Commission would be the guardians of the European treaties, right? And I'm not suggesting now that we should enter into a new litigation, but I'm just asking, is there any other way than a political way to actually start with a constructive dialogue around tobacco harm reduction, which I think we might not have seen as prominent as we would have wished from the WHO side? Thank you.
Thank you, Cecilia. I have been in situations in conferences where the WHO and officials have actually protected my right to be in a conference. So I know we have a lot of bad things often to say about the WHO, many are true, but I should think that there is also the other side of it, which I would give them credit for. I think one of the things that we often, they talk about the WHO and the FCTC interchangeably. They are completely different. Yes, the WHO is the custodian of a piece of paper, a treaty. The FCTC is not an organisation or an entity. It is a treaty, a paper. And yes, there is institutions and entities that manage that as part of the Tobacco-Free Initiative, as part of the WHO. It's important to make sure that you know what you're talking about when you do that. I do think there's, I think things I've seen, and I mentioned someone earlier, I've seen since that original time through the ages until now a change, and I really do think with the TPD and other things that things are moving more towards a reasonable and acceptable sort of situation. And I think that reaching out to and trying to create dialogue with is really important. Alex Wodak said to me, you know, if you look at the Middle East, you don't get peace unless people are talking, and it's the same with the WHO and the industry, for example. I do think that, but the one thing to remember is the WHO is its membership. That's what it is. The WHO can make no decisions about anything. The WHO did not write the FCTC. It didn't. The WHO members wrote the FCTC, and that is the health departments of the 193 governments that negotiated it. So it's really important not to blame the WHO. It's the governments that took part in those negotiations, and it's how they come back and interpret it. And that's where I think a lot more work can be done in this modern time to build that back again.
It's good to talk, isn't it? Another question here.
Hello, I'm Maria from Eastern Intelligence. I would like to ask John, what is his experience in China, in advocating in China and Hong Kong, and where do you see industry going over there? Thank you.
Well, we do know that the state controlled authorities in China have been spending about 18 months of the last, they're about 18 months through a 2-year program to start evaluating harm reduction in the tobacco sphere. We have very unofficial, I don't think you already quoted on this, but very unofficial intelligence in the last week that the SNTA is close to some kind of decision, but obviously it's not going to be conveyed at this stage. In Hong Kong, where we've been active over the past 2 or 3 years, it's really not a microcosm of PRC. And to follow on from the last question and Jeannie's answer, it's very much a WHO fiefdom in Hong Kong. I thought Jeannie was rather letting on WHO off rather lightly, because WHO in a place like Hong Kong is extremely disruptive and malicious. It is a source of spreading lies about e-cigarettes, vaping and tobacco harm reduction in general, which has had a considerable negative effect. I, for example, had to make a presentation in Leicester, the Parliament in Hong Kong, almost 2 years ago, which was responded to by Sophie Chan, the head of the department responsible within the health ministry, who followed my presentation by talking about smoking e-cigarettes. Now, fortunately, she was told by the chairman of the LegCo to go away and look at the facts and come back 6 months later. But when she came back 6 months later, she was still stamping the official WHO line, which was that the sky will fall in if you allow e-cigarettes. So, in my region in general, and China is part of that region, but not really active, because obviously it doesn't pay any attention to WHO. Anywhere that does pay attention to WHO is towing the line officially. And there is a huge dichotomy between the consumer and authorities in that regard.
Thank you, John.
Yeah, Brian Coe, Stanley United Consumer Advocate. Just a question for Deborah. You say you're in full support of TPD because we need the safety. But there's one thing that's been forgotten, is that it was already reported, vaping's already been reported as being 95% safer before any regulations came out.
Sorry, what I was saying was, I was talking about the TPD as a tobacco products directive. E-cigarettes are a tiny part of that. I'm not defending the specific measures in the TPD, but they haven't in the UK been disastrous for vaping. The 95% figure, yes, they're significantly less harmful, but that doesn't mean they don't need regulating, because tobacco, you have to remember, smoking is so dangerous that even something that is, if it were the case, 95% less harmful, is still not harmless.
Yeah,
and the point made by John Britton, which I think is really important, is that people who switch to vaping who've been smoking for years have compromised immune systems, have damage done to their systems already, which means that they're probably more at risk from vaping than someone who wasn't a never smoker previously. And we certainly wouldn't recommend that if you're never a smoker, you take up vaping. But it's not completely harmless. It does need regulating. You know, I remember a couple of years ago when it came out about diacetyl, part of the problem at that time was we didn't know what was coming out. You know, part of the notification process is that we have a sense of what's actually in these products. And over time we can work out what the impact is. Inhaling things into your lungs are incredibly delicate. It's not by and of itself necessarily a good thing, but it's a lot less harmful than smoking. So we're certainly not saying don't vape, but don't think it's completely harmless.
Brian, just the point you make is actually the TPD, Article 20 was voted in beginning of 2014. Public Health England's report was August 2015. So, you know, that wasn't actually right or whatever. I think let's just pick up the other...
The point on that was, on that basis, what justified TPD regulation? It's over-regulation. There's nothing about vaping that deserves 10 ml bottles, 20 ml milligrams per millilitre of e-liquid in 2 ml tanks.
Yeah, but for some reason in the industry, there are a lot of issues still in Article 20 that as an industry we need to be working with and talking to the Deborah Arnotts and all of the organisations to make sure our products are better understood, the issues and challenges we face. And something I'd like to talk to Deborah outside about is the rate, if there is going to be a rate of the market's going to slow, is that a concern for public health or not? What have we got to do about it to try and make sure that that growth continues? But I think that's something for outside and not for...
Yeah, I'm not saying there should be regulation.
Brian, I think we should be fair. I think we should be fair to other people in the room.
I just want to come back at that.
Yeah. We could pick it up outside, shall we? I saw some other hands showing up. Sarah?
Thank you. Deborah, sorry, I'm going to pick on you again. I want to drill down on this 6% of vapers who are currently using over 20 milligram per millilitre, because for me I think that's one, or probably the most harmful part of the e-cig part of the TPD. I want to get your further thoughts, because so far what Ash have said is almost it's only 6%, which translates in the UK to 174,000 people, and it will be more because it will be a greater percentage of people who are trying to switch because they'll generally use the higher strength. So we seem to be saying that we will sacrifice those people, which, to put it in context, is almost the same number as Stop Smoking Services achieve in terms of 4-week quitters. So we're sacrificing those people for what? What is the benefit that we get?
I'm not saying it's non-existent, but I went back to look at when the TPD was going through and people were saying, and remember, we didn't lobby for a 20 milligram limit. We weren't involved really in those negotiations, but certainly I told people at the time I didn't think that was a sensible idea. I don't think that was something, it was not something we supported. But we were told at that time this was going to be disastrous, it was going to destroy the e-cigarette market. And that has not proved to be the case. Now, that's not to say that I think it's necessarily brilliant, but it ain't going to change anytime soon. So products have to be developed that get around that. Or, for products with higher levels of nicotine, I would suggest they talk to the MHRA, because there's a process there for getting higher strength products onto the market, which you could then advertise, you could promote for quitting, which is what a lot of vapers want to use them for. So there are ways around that, but you aren't going to get rid of that anytime soon. And I make no apology for actually reporting what the data shows, which that it is not the case.
We've heard the point. I think it goes back, it's good to talk. We are where we are. There's no point in going back and talking about what happened 2 years ago. We need to be looking forward and how we're going to address these things.
Hi, Ryan Carolina from the Consumer Choice Center. My question was for Professor Stimson. I found your conversation about using the Court of Human Rights and their fundamental rights a very innovative approach, but I just had a question about if you could flesh out the details, because like using Article 7 and the respect for private and family life, most consumer and lifestyle regulations would fall under that. So if you could just detail that a bit, please.
Well, I'll be very brief because it's quite a long argument and I can tell you more outside. But the right to private life and privacy does encompass a whole range of issues regarding autonomy. To be able to do things without state interference and the limits of the state to interfere with personal autonomy and personal dignity. So that's where the privacy argument comes in. The key argument is also in Article 35, where there's this issue of health protection. But it is a rather longish legal argument, which I'll be pleased to talk to you outside, so I don't think it's worth our time going into the detail now.
Can I just add something? Can I just add, and I haven't spoken to Gerry about this, but in the hierarchy of laws, the EU and the international law, I would imagine, and Gerry's lawyer could, but those preamble of the FCTC human rights requirements to ratifying countries, those obligations to protect determined to protect the human right to health, etc., enshrined in that can be drawn upon to support argumentation that he would be used in that case. And I would think it would be very important for them to do so, because each of the member states and the EU and the UK have all ratified that obligation.
I can see through the sun. Clive is in the back there. Clive?
Just a quick question just to throw at the panel. If there's one policy or regulatory thing you could change to improve the progress of harm reduction in tobacco, what would it be?
Someone else can start.
Can I go first? I wouldn't go on policy, I'd go on perceptions of harm. If we could just go back to a world where nicotine wasn't being promoted as it was historically, as the major cause of harm. You know, we know that doctors in the UK, you should know better, a lot of them think nicotine causes cancer and it's the harmful substance in cigarettes. If we could wave a wand and get rid of that around the world, then I think we'd be in a lot better place.
So Deborah, why not put messages on the packaging that say that? You know, there must be a policy way of achieving, I agree with you by the way, achieving what you've just said ought to happen with a policy intervention.
I think I have to answer. You can't, you know, you're putting chicken before egg, you can't get a policy on it until you get the change in perception, unfortunately.
If the Brexit theory came along, I think it would be to do away with the ban on advertising. But I think there's really there's not simple policy strokes, and there's the beginning of what needs to be a discussion about moving from a tobacco control policy to a tobacco harm reduction policy, and a rethinking of tobacco laws to encompass this proliferation of products and products with very different characteristics and very different risks. So, you know, can't put everything in the same bucket, but I think this is a kind of 5 or 10 year discussion that's going to have to take place to move drug. There's a case of tobacco policy reform, and that's a long discussion.
We should just let the other four make their points on there.
Good question, Clive, and obviously what Gerry just said follows on from what I was saying about making sure we clarify the language. But also speaking for, not speaking for 2/3 of the world's smokers, I don't go that far, but 2/3 of the world's smokers would like policy to be more evidence-based and less based on cant.
I would argue technology transfer and policy transfer from the progressive countries to the LMIC.
Yes, it is a good question. I would say that I would like to see any regulation that affects consumers and stakeholders actually engages with stakeholders and is mandated to do so, and is a continual process. And it should be the right consumers, as opposed to who they maybe think could get in there.
In thinking about it, I would say that the biggest change would be to remove the ban on ability to communicate, because I think without being able to provide information about what is available, what is there, debate the issues, it's really impossible. And you know, in that context, I think one of the things that could be is that in the Vienna Declaration of the interpretation of treaties, anything that leads to a manifestly absurd or unreasonable situation in due course is an area that can then be revisited. And I would think that there are some areas, such as the communication ban, I'm not talking necessarily about advertising brands, I'm talking about the ability to communicate about the issues, which is banned, and some of the really radical 5.3 interpretations where you can't even talk to somebody are really inappropriate. But the one thing I would do is remove the snus ban. That is something that seems absolutely ridiculous, that cigarettes and e-cigarettes are allowed, and the one thing that has huge epidemiological research to indicate that it is safer is banned. That is absurd.
Thank you very much. I'm really sorry. I've just had a message that we've got to stop, and so I've probably made a lot of enemies today, and been bossy with the six of them, and frustrated questions. But masses and masses of things. I think it's been an unbelievable debate in terms of the contribution from the six people here. So I think we could join in. Thank you.